Today, I'm delighted to welcome back Dr. Sunny Virdi from Winnipeg, Manitoba, for part two of a two-part series about how to get really good proximal contacts when doing class 2 restorations. Sunny, yesterday we talked about the armamentarium you use, and today you're going to show us some cases. Give us a little background on what cases you're going to demonstrate.
It's nice to be back, John, and I'm excited to share the cases with you guys today. I have prepared three cases. The first, we're going to talk about just a routine case for class 2s. The second, we're going to do something a little bit more complex. And the third case I have is we're going to talk about back-to-back class 2s and how to get a good contact with those. So let me pull up my cases and let's take a look together. Thanks for having me back here, John, for part two on CDA Oasis Live. I'm wearing my scrubs today because I really wanted to be in the mindset of doing clinical cases. So, yesterday we talked about all the different options of matrices, wedges, and rings. And so how do we decide which ones we're going to use? And the two factors that I look at is the distance and the height. And what I mean by that is the distance between the prep and the adjacent tooth and the height of the prep, whether it's, really subgingival or gingival margin or very shallow. There are an infinite amount of possibilities, but I'm going to share some things with you guys that I do. Just a reminder from yesterday, I just want to, send this point home is don't burnish your bands, guys. If the band's not contacting properly, burnishing doesn't fix that. It means you need to try a different combination. So I just want to put that there again. So let's look at a routine case. This is a daily dentistry class 2 replacing a failing composite with a concave profile that has recurrent decay underneath. So we go open it up. This is the preparation and caries removed here. As you can see, it's pretty deep. The prep, I know we talked a lot about the equipment, but the prep also has some requirements. So proximally, the buccal, palatal, and the gingival margin all have to be open. This is by no means your textbook prep here in this picture, but this is just daily dentistry. Sometimes it's big, and this is how it looks. I usually prefer a less curvy and irregular gingival floor, but we talked about yesterday, premolars have that anatomical groove and furcation that, it looks like this sometimes. And I don't want to take away more enamel. Enamel is the key for success in these restorations. And what is the point of the clearance? The point is that the band has to see passively. The band, it speaks to us, John. So when I showed the last picture about burnishing, if the band looks like that, the resin reflects that. So if your band is all wrinkled and, crinkled up, that's how your filling is going to look. So listen to the band. If it looks nice, your restoration will look good too. So here's the placement. So how did I pick these ones? So the space between the prep and the tooth is about 1 millimeter, maybe a little bit more. And the prep is about equigingival. So in these cases, I use a dead soft matrix with a plastic wedge and a separating ring. I prefer the 3D fusion rings from Garrison. I know I made that pretty clear yesterday. The reason, I don't think I told you guys the reason for that. The reason is that they have the highest separation force of any separating ring, which is important. It's what it's supposed to do. I don't have a study for that, so don't quote me scientifically, but I have tried many of them, and this one has the highest separation force. So first things first, I place the matrix. Here I'm using the Garrison 3D Fusion Dead Soft one I was talking about yesterday. This is the premolar band. And I'm using a plastic wedge. So if we have separation forces from the ring, the plastic wedge is your best friend here. I used a BioClear one. I really like the design, but Garrison, Paladin, they all make good plastic wedges. You can use a wooden one if you want. You don't need to, but if you want to have that extra push and really get it in there, you can. But you just have to make sure you customize it. And I'll show you guys what I mean by that. And then on top of that, the separation ring. These things are really easy to place. And you can see here, the buccal and lingual are really nicely sealed. The gingival floor is really nicely sealed. We're going to have minimal flash here, John. So minimal time of cleaning up, and it's going to save you time. It looks like it takes a lot of time to set up, but you'll realize that your appointments are going to go a little bit quicker because you won't spend as much time finishing and polishing. So in terms of placement, this is the ideal placement. Everything's sealed. And when we look at the final, Here's some initial finishing and polishing after the final. You can see a nice broad contact. Everything's in the correct place. Here's with the rubber dam off. After I checked occlusion, you can see the occlusal points there. Is what I call the perfect kiss between premolars, right in between. You know, the contact's in the right area. We're not going to have food impaction. The papillae is going to be happy. The patient will never realize the beauty of this. Like they can appreciate that, but you know, us OCD dentists, we know. And what they do appreciate is no post-op problems. You know, no sensitivity, no food impaction. They're not worried about it breaking. For all intents and purposes, looks and feels like a tooth. So that is the routine case. So the next one here is, this one I find a little bit trickier. This is the premolar canine contact. And I had a lot of issues personally with this one. Like I would struggle placing a ring here. Usually separating rings don't fit here. I would use a Toffelmeyer, and if I broke contact, I would, you know, have an open contact after. So I had to find a way to make it a little bit different. Usually the canine, the cingulum, it doesn't allow us to place a ring here. So this is the case here. So after I prep, like I said, I look at the height and the distance. So the distance between these two teeth is less than a millimeter, maybe just really close to a millimeter. It's quite shallow. So in these cases, I use a kidney beam matrix because they're quite firm. You don't have to worry about them distorting. And because I can't use a ring, I have to use a wooden wedge. So no ring, wooden wedge. Ring, plastic wedge. It's quick, effective, you know, it's an easy setup. You could also use one of those G-rings that we talked about. Those can work here, but it does get complicated and they can be tricky to use. So I just prefer to keep it simple. My tip is if you are using a wooden wedge, again, we have to customize it. So I'm going to show you guys the customization in a second. Here's the finished product. You can see we have a really nice contact here. You know, nice round marginal ridge. On the other side, of course, we did back-to-back class 2s with separation rings, and the next case I'm going to show is a back-to-back class 2. Here's the wooden wedge customization. So what did I do? I put the wedge in when I was prepping the tooth. When you prep and you open up the box, you'll take away a little bit of the wedge right here. And that's the customization, because if I left this here, that means that this part here would have been sitting in the restorative space and you lose your contour. So pre-wedging, I mean, it's something that we were taught in dental school, and you know, there's the reason for it. So pre-wedger cases, especially with wooden wedges, you're going to get the perfect customization right here.
And did you use the scalpel to do that little bit of customization there?
No. So when it's in between the teeth, when you prep, the burr does it. So you don't even have to touch it. It's perfectly customized for you already. And that's why I really recommend pre-wedging. If you don't, I mean, you can take a burr and you can customize it, but if you pre-wedge it, you have the perfect customization. Last case here. So lots of people ask me about back-to-back class 2s. How do you do them? There are, like, again, a million ways to tackle these cases. I'll go over one way, which I think is maybe the most simple, and it's just to take it step by step. You know, there's some crowding here, which makes things a little bit trickier, but we just go. So I prep both simultaneously because I don't want the anesthesia to wear off. You know, patients like good fillings and restorations and speed, but they also don't like when things hurt. So prep first before the anesthesia wears off. One option that I like here is I put both matrices at the same time. The point of that is that if you only put one matrix there, when you put the ring on, the matrix is going to invade into the space over here. So it's a space holder. The ring is not necessary if you don't want to use it, if you have a big wedge. I just like it. I don't care about the separation force. I just like to seal the buccal and lingual, and I have minimal flash that way. So I use the plastic wedge again, separating rings. We use plastic wedges, easy. Here's a view right after I took the band off, and you can see like the perfect contact point location. Now we have an opportunity to go back and finish and polish everything. And you know, once everything's finished and polished, here's the result of the first filling. Nice contour, nice ridge, and you see how we have now this nice space for the premolar. This makes it easy. Now it's what we talked about in the beginning. Now it's a daily, regular class 2 filling. So I'm going to put my, you know, dead soft sectional matrix. my plastic wedge in there, my Garrison separating ring, just like we saw in the first case. And there's the final. This is after occlusal adjustment. I like to show with the adjustment afterwards, because some people will say, after you adjust, it doesn't look like that. No, it looks like that. You just need to use the right equipment when you do it. And it's pretty clear. I mean, this contact is nice and broad and heavy. The patient's going to have no problems. And I hope this lasts them a long time. But there's my little run through of how to use those pieces of equipment in 3 different ways.
So, if you're just to recap, give us, just for our friends on Instagram, in less than 60 seconds, what are the key points that you showed today in those 3 cases?
Key points are, first of all, look at the distance between the teeth. Okay, if you have a smaller, shallower prep, you could probably get away without using a separating ring. If you have something that's a little bit wider, you need to use a separating ring. If you use a ring, use plastic wedges. If you don't have a ring, use wooden wedges. And number 3 is just take your time and enjoy it. It's a fun process.
Dr. Sonny Virdi, thank you so much for taking time yesterday and today to show us your tips for getting good proximal contacts when doing class 2 restorations.
Awesome. It was a pleasure, John. Thank you.
We hope you'll come back again.
I'll be back. I got lots here.